watching TV9 Digital. I'm Neha. In these desperate times, we're living from day to day, hoping and praying that COVID-19's second surge will abate soon. But now, there is some more grim news that the central government shared with us all on the 5th of May. K. Vijay Raghavan, Principal Scientific Advisor to the Government of India, said that the third wave of coronavirus is inevitable. In fact, he said, and I quote, "A phase 3 is inevitable given the high levels of circulating virus, but it is not clear on what time scale this phase 3 will occur, hopefully incrementally, but we should prepare for new waves." While talking about the new variants and their transmission, he said, and I quote, "New variants are transmitted same as the original strain and it doesn't have properties of new kinds of transmission." Now, to understand what will be the shape of the third wave, I spoke to public health expert Dr. Vivekanand a little while ago.
So welcome, Dr. Jha. My first question to you would be, the center has said that the third coronavirus wave is inevitable. Would you kindly break it down for us as to how severe it is going to be and when will it hit the country?
You're asking me to speculate quite a bit. So I think one of the things that one can be safely said that this statement is in a way hedging, the bets by the center. What we know about this pandemic is that this has, wherever it has affected the world, it has come in waves, right? Because that's the way the virus behaves. People get infected, and then there is some action, for example, a lockdown, and then the rate of infection goes down, and people come out and start mingling again, and maybe relax the precautions that they have been taking. In the meantime, the virus might have undergone a mutation, and then it suddenly starts to spread again amongst people who are vulnerable, which means people who are unvaccinated, right? So as long as this state lasts, it will go up and down. The only way to make sure that there are no future waves is to reduce the population that is susceptible, which can happen only through mass vaccination campaigns. Now, your second part was, how big it is going to be. I think that's pretty much impossible to speculate at this point in time. Like I said, it all depends on a few factors. What is the size of the susceptible population? So the susceptible population means people who don't have antibodies either because they might have been infected previously or because they are vaccinated. The second factor, of course, also is the responsible behavior, observation of COVID-appropriate behavior. Because even though the virus is amongst us, what the virus does to the communities, what the virus does to individual is not inevitable. So it's not a given. And we can influence that by taking a lot of actions, both at the level of individual, at the level of the society, at the level of the healthcare system as well.
Dr. Jha, we're seeing how badly the second wave has impacted the entire country. So does it anywhere look like that, we are sort of ready for the third wave in terms of preparation?
Look, it's hard to say. Right now, we are struggling to manage the large surge of people with very severe disease that is presenting to hospitals and overwhelming healthcare systems. So this is really, as has been said before, this is such a wave of such a magnitude that was not foreseen by almost anyone, right? So that is why it is overwhelming the healthcare system. Whether the next wave will also have a similar feature, I don't think so. Firstly, because we are definitely much better, we are going to be much better prepared next time around. Because people had kind of bought into the view that COVID was done with and it wouldn't come back to our society. Now that our fingers have been burned so badly, I think people will really expect it to come back. And so there is greater degree of preparation, both at the level of the society and also probably at the level of the healthcare system. So hospitals will be better prepared. The hospitals that are closed down perhaps will not be closed down. And so I think we will, I think, and I very, very sincerely hope that we will not have a problem of the magnitude that we are seeing this time around.
So, Doctor, what lessons have we really learned from the first wave as well as the second wave? And in the third wave, where should our focus be?
So our focus should be that we should not have a third wave, first of all, by making sure that we get out of this second wave. And while we are doing that, we really ramp up our vaccination efforts and prioritize vaccinating people who are most vulnerable to getting the infection. And that includes people who have just, because of the nature of their business, they cannot stay away. So many people who are relatively privileged, who have homes, who can travel in their personal vehicles, are relatively privileged and they can stay protected. But people who have to go out and mingle, for example, your neighborhood vegetable vendor, your newspaper hawker, people who go for household job from to different houses, they are the most vulnerable people. So they should be prioritized. And I think we should also recognize the fact of ring vaccination, which means that making sure that a vulnerable person is protected also requires the people around them to be vaccinated appropriately. So our vaccination effort has to be ramped up quite a lot, which will reduce our likelihood of getting a third wave, or even if there is a third wave, it will be small and it will be relatively easily contained. So the population needs to continue to adopt the COVID appropriate behavior, and our hospital system needs to be appropriately prepared.
Dr. Jha, it's being predicted that the third wave will be severe on the children. On what basis? What's the basis of this prediction?
I think that is a little premature to say that it will be severe on one particular age group. One reason could be that if all the adults are vaccinated, children will be the quote unquote unprotected population, and so they are most likely going to be vulnerable to the wave of coronavirus infection that might come during that particular point of time. And secondly, only if there is a change in the virulence of the virus through mutations that might make them particularly prone to causing severe disease in children. Otherwise, I don't think that there is any good indication to suggest that children will be particularly prone to the next wave in terms of the severity of infection.
Right. Lastly, Dr. Jha, I'd like to ask you, looking at how the vaccines are being developed as the pandemic rages from mutation to mutation, will we ever have a vaccine, especially for the kids, since Canada has already approved a Pfizer vaccine for children between the age group of 12 and 16?
Oh yeah, absolutely. Look, one of the real success stories of this pandemic has been the rapid development and rollout of vaccination programs around the world. So I think the scientific community can be justifiably proud of this particular achievement. When vaccination efforts had started, most people were predicting that we will have a vaccine by the summer of 2021. And look, by the summer of 2021, many countries have achieved very high degree of population coverage of vaccination, and many other countries are starting as well. So vaccination program gives us a lot of optimism and a lot of hope. And I'm absolutely confident that the scientific community will be able to develop vaccines which will provide all-round protection against variants to all age groups, including children, adults, etc.
As per reports, the central government is mulling over a complete nationwide lockdown. The government finally seems to have woken up from its deep slumber. I hope you have too. Take all the preventive measures, follow COVID appropriate behavior, and stay safe. Thank you very much for joining me. If at all you've liked the information that I've shared, do not forget to subscribe to TV9 Digital across all social media platforms. Stay safe, keep those masks on.